Hello friends, this is Dr. Ashok Kumar. Here in this video we can see this is a soft cataract which we planned MSCS with toric IOL. Here the IOL used is from Zeiss called AT Torby. Here in this video all the steps are fast forwarded. After the toric markings are done, you can see after staining of the anterior capsule, we fill the AC with viscoelastic. Rhexis is done, and we need to keep in mind that for all these premium IOL cases or toric cases, the size of Rhexis should be 5 to 5.5 mm in diameter, so that the anterior capsular rim overlaps the optic of the IOL. And during the main entry, our main entry should be very precise so that our surgically induced astigmatism is as minimal as possible. After our main entry, we do hydrodissection. A proper hydro is necessary so that proper cleaning of the cortex is done during cortex aspiration. The main challenges while doing Phaco in soft nucleus is we'll be unable to crack the nucleus. Even though we trench deep enough, cracking of nucleus will be difficult. So in this scenario, my technique is when you are unable to crack it, just make a large crater. And once the crater is done, with visco cannula, just like hydro, under the anterior capsule, just inject visco so that we can tumble the nucleus. And once the nucleus is tumbled, we can easily break the posterior plate and we can do the Phaco of the rest of the nucleus. This technique helps in maintaining of anterior chamber and Phaco in soft cases. This technique can also be done in cases with moderate to hard nuclear sclerosis. But the care we need to take is we need to do a large crater at the center so that debulking of nucleus is done. Once the debulking of nucleus is done, there will be ample space so that we can tumble the remaining of nucleus and epinucleus. This is a very safe technique which prevents PC rent because the PC is pushed away by the remaining nucleus and epinucleus. Coming to the case, after proper polishing of PC and filling of the chamber and bag with visco, the planned IOL is implanted. Here this IOL from Zeiss is having plate haptic, so this can be rotated in both directions. So after implantation of the IOL in the bag, we need to make sure that there is no visco left either in front of the IOL and behind the IOL, which will make our toric IOL to decenter or at least change its axis after the surgery, which will lead to not attaining of the desired surgical outcome. After the total visco aspiration, we need to finally check once for the axis so that the IOL is in the desired axis and the case can be closed. Thank you.